Good afternoon. My name is Paul Edwards. I'm with the Governor's Office, and we're grateful that you could join us this afternoon for our daily briefing. We will hear first today from Dr. Angela Dunn, our State Epidemiologist, and we'll go to that point in today's program and welcome Dr. Dunn. Thank you, Dr. Dunn.
All right, good afternoon. We are now at 1,976 Utahns with COVID-19. That's an increase of 130 from yesterday, or a 7% growth rate. We have tested 38,373 Utahns for COVID-19. 2,257 of those results came in yesterday, and we're still holding steady at a 5% positive rate. We have a total of 168 hospitalizations due to COVID-19 over the course of the outbreak, and about half of those have been in an ICU bed. I do want to mention a very important group in this response, our coronavirus information hotline operators. They're a group of highly skilled medical professionals and have been working 24 hours, 7 days a week throughout this response. And yesterday, they took their 50,000th call related to COVID-19. You know, there are a lot of things that we've been asking the public to do, from social distancing, monitoring for symptoms, isolation, and these operators have been providing an invaluable service to the public, giving them the right information about how they can keep themselves and their family healthy and safe. We also want to give a message to our healthcare providers on the front line. We now have the capacity statewide to test all patients who have symptoms consistent with COVID-19. So if you have a patient who has fever or cough or shortness of breath, and you think they might have COVID-19, we have the capacity to test them, and we want you to send them for testing. You can go to coronavirus.utah.gov or call our hotline for more information. All right, with that, I'll open it up for questions.
This is Michael Orton with the Capitol News Service. The dashboard that the Department of Health maintains indicates that testing has dropped off from a high of about 376 negative results a week ago to this Tuesday's number of 972. Given your previously stated concerns about testing supplies and various reports at the federal level, do these decreasing numbers and the comment you just made about testing patients, seemingly patients only, does that mean that our tracking ability has been compromised by your previously stated concerns about testing supplies?
Yeah, so we're lucky in the state of Utah that over the most recent days and weeks, we have been able to increase our capacity for testing for COVID-19. We have great partnerships with ARUP, the University of Utah, Intermountain, and TestUtah.com, and other healthcare systems across the state that have given us the ability to increase our testing to about 4,000 to 5,000 Utahns per day. And we have now the supplies in state to be able to conduct these tests. So we want anybody who has symptoms consistent with COVID-19 to seek out testing. And they can do that by going to our website, coronavirus.utah.gov, or calling the information hotline.
Hi, Dr. Dunn. Thanks for taking my question. I was wondering, you mentioned the reason that we're now able to test more people is you've gotten more supplies into the state of Utah. What changed that allowed you to get those increased supplies?
Sure. So working with our governor's office and the lieutenant governor's task force, we had some really innovative people who were able to make connections to be able to secure supplies necessary for us to be able to test all the Utahns who need testing for COVID-19. So again, we're very fortunate in our state to be able to offer that to anybody who has symptoms.
Hi, Dr. Dunn. With regards to getting the workforce back in place, one of the concerns is with when you have your stay-at-home order is that people can get infected by family members. So I know that's the big picture. It's a good thing, but that is happening. Is there any plans such as like utilizing empty hotels or actual workplaces where workers who are tested and are negative can go back to work confident that they and their colleagues aren't negative, and then kind of sleep in an area, whether it's their office or a empty hotel for the time being, and and just kind of use that process of circulating new workers into the workforce? Is there any plans along those lines?
Yeah, that's an interesting idea. All of our kind of hotel planning and quarantine sites have been for people who are potentially exposed to COVID-19 or test positive. We haven't started the discussions on kind of what you're suggesting of if you know they're negative, putting them in a hotel so that they're not being exposed by their family members. But that is an interesting idea that we'll have to explore.
Thank you.
Hi, can you tell us, a number of other states are reporting the number of patients who have recovered. Utah is not. Can you tell us, I guess, why that is and what the definition of recovered would look like? Is the state looking to get information about how many people have recovered?
Yeah, I mean, you basically hit the nail on the head there with what is the definition of recovered. So nationally, there is no standard definition coming from our federal partners about what recovered means. Again, we're lucky to have over 90% of our cases not needing a high level of medical care, and they're recovering at home on their own. So tracking those does become difficult. However, we are looking at definitions such as anybody who has had the disease and we've identified them 3 weeks or more ago, and they haven't passed away, considering them recovered, or if they're not in the hospital, considering them recovered. So we have been looking at preliminary numbers, but nothing right now is very clean because there is no standard for defining that, and we're just not able, luckily, to follow those patients all the way because they're able to recover at home.
Yeah, Dr. Dunn, Salt Lake County today modified its stay-at-home order, extending it until May 1st, saying that modeling is starting to show that that's a good time to maybe start looking at phasing in and lifting restrictions. What about the state as far as directives, and do you concur with what Salt Lake County is doing?
Yeah, so those conversations are definitely happening at the state level out of the governor's office in conjunction with experts from the Department of Health and others. We're letting data drive our decisions, just like Salt Lake County is doing. So it's important that individual jurisdictions do have the authority to be able to make those decisions based on the spread of disease in their jurisdiction. So we support Salt Lake County in their efforts, and we're looking at our statewide data to drive those decisions moving forward as well.
Yeah, hi, Dr. Dunn. Question for you. How does a person, family, or caregiver get a COVID-19 test for an elderly person without having to take them to a mobile drive-through site?
Sure. So we actually have at the Utah Department of Health mobile vans that can go to sites and test those who are otherwise homebound, and we work with our local health jurisdictions to get that done. So those options are in place, and we use those as kind of a case-by-case basis. So when those situations arise, we do have the capacity to be able to figure them out.
Thank you.
You've talked quite a bit in the last couple of days about masks, and obviously there have been changes in certainly how the CDC is presenting the public wearing masks. If you can explain a little bit, is there a difference between wearing the homemade cotton mask and the typical medical mask? Is there any effectiveness to just a simple cotton mask?
Yeah, so the recommendation behind the general public wearing homemade masks is that we have identified throughout the course of this outbreak that asymptomatic spread is not only likely, it's probable. And so if somebody is, mildly symptomatic and they're wearing a homemade mask, they are less likely to spread the disease to others. It's very important, though, that we save our medical grade masks for our healthcare community. We know we're going to have shortages, and they're the ones who are at most risk for contracting COVID-19 from sick patients. So the general public, wearing homemade masks is recommended if you're in a situation where social distancing is impossible. Social distancing is still paramount to this response, and it will still help us drop cases down. But for example, if you're going to the grocery store or a pharmacy and you're in a situation where it's just not possible to stay greater than 6 feet away from people, wearing a homemade mask will help you not spread whatever you have, potentially COVID-19, to others, but it will not protect you from getting it.
Gotcha.
Yes, thank you. So the CDC has data showing a disproportionate number of Black Americans are being hospitalized and dying from COVID-19. Are we seeing that here in Utah with Black Americans accounting for more hospitalizations than they should based on their share of Utah's population?
Yeah, so we actually pulled that data yesterday. Our race and ethnicity data is not complete, and so we're looking at ways to fill in the gaps to make it a more sure picture of what's going on. The numbers are still so small that being able to identify trends in our non-white population is very difficult in Utah, but we're working on ways on how we can present that to the public without risking identifying an individual who is sick with COVID-19. So we're hoping by next week we'll be able to show that data publicly.
Yeah, hi, Dr. Dunn. I know we can't track the number of people who have recovered from home, but can't we track the number of people who have been discharged from the hospital if they came in with COVID symptoms?
Yeah, absolutely. And that's part of our definition. But again, we have such a small hospitalization rate with less than 10% that the vast majority of people are recovering at home. So being able to give the public a clear picture of who is currently under isolation with COVID-19 and who has recovered is something we're actively trying to do. We just want to make sure that the data we put out there is an accurate picture of what's actually going on so that people are clear in their interpretations of the data.
Yes, I'm curious about the trials and studies, especially the ones here in Utah, but I've also been reading about ivermectin used to treat scabies out of an Australian lab. Any comments?
So I hadn't heard that ivermectin is being thought about as a potential cure for COVID-19. The ones specifically going on in Utah are dealing with hydroxychloroquine and azithromycin. Those are the two drugs that were showing promise out of some of the Chinese data coming out. So that's what we're studying here. But yeah, I hadn't heard anything about ivermectin.
And when do you expect results or something to report?
I mean, they're just launching now in terms of enrolling patients. And so it's going to be several weeks before we have any preliminary data.
Thank you.
Sure. Okay, thank you guys so much.
Thank you, Dr. Dunn. We'll now have the opportunity to hear from Governor Gary Herbert, and he'll be accompanied today by Mikelle Moore, who is Senior Vice President of Community Health at Intermountain Healthcare. Governor Herbert.
Well, thank you, Paul. And again, welcome to everybody. It's good to be with you, and we again express our appreciation for those who are involved in this effort to give a daily briefing, particularly the media who helps get the messages out to the people of Utah so that they have current information to help them adjust their behaviors accordingly. So thanks to one and all. Let me, in my brief remarks here, let me just say that what I've come to appreciate more than ever before is the ability and desire of the people of Utah to work together. The spirit of collaboration and cooperation has always been one of our secret ingredients to the success of Utah. And in times of adversity like we see here today, it's never been more important nor more on display. So I thank all of those who are demonstrating patience, a concern for their fellow man, their neighbors, the private sector that's stepping up and trying to provide new innovative ways for us to accomplish what we need to do, not only in healthcare, but also in trying to maintain and recover the economic welfare of our state. So thanks for that cooperation. I've been putting some bouquets out for different sectors of our society. Let me today mention the performing arts groups and our sports teams. Probably no sector has been hit any harder than those organizations and those providing arts. It's a struggle in the best of times for them to be able to maintain the arts in our state. We are a state that's been founded really at the beginning with arts. When those early pioneers came into our valley, one of the first things they built was a performing arts center. We have significant arts and success in our arts here in the state of Utah, and one of the best art states in America today with the talent we have. So I appreciate the challenge they're facing. Our sporting teams, from the amateur ranks, high school, college, to the professional ranks, it's been a challenge. And many of those closed their operations voluntarily before any kind of directive came out. Again, being concerned about their fans, making sure that they had a safe environment for them to come and participate. So let me just have everybody recognize their support and their willingness to work in behalf of the common good of the state of Utah. I certainly expect that we're going to get through this in short order. But for those who have the ability, if you want to buy your season tickets for next fall, next season, please do so. Your membership in art guilds and art organizations, again, I would encourage you to help by doing that. That's going to help them prepare for the next season coming up. Second, let me just, again, thank all those who have been willing to follow the directions that we've given. Again, it's most people are doing that. We still have a few outliers, which we hope that they will change their behaviors, but we appreciate those that follow state directives and local orders and their behavior to stay home, stay safe, again, eliminate unnecessary travel, keeping social distancing appropriate in the venues that we go to. And I appreciate that people are following our state directive. One of the reasons I talked to Dr. Fauci yesterday was to, in fact, make sure that we are in line with what's being done on a national level, at least the collaboration, the mutual understanding that we need to have as we all have roles to play. They're not always the same, but they certainly should be in collaboration with the common goal of slowing the spread and eradicating eventually the coronavirus and having a recovery of our economic health and well-being. So I appreciated the opportunity of talking to Dr. Fauci yesterday. As you know, President Trump announced yesterday that his nationwide directive will continue in place until the end of April. We have a directive in place right now, our stay home, stay safe directive. We also will extend our directive till the end of April to kind of mirror what's being done nationally. It's based on not only the willingness to work on a national level with mutual understanding, but also because of the data. The data that we have shows that what we're doing is working. As I've mentioned before, the 2 weeks ahead of us are the most critical, and that's still kind of the same today. The next 2 weeks are very critical. That takes us to the end of April. And as we look at the weekend, the Easter weekend, I know, again, is a traditional time for people to celebrate with family vacations and spring breaks and those kinds of traditions, which we're going to ask the people of Utah to sacrifice and curtail. Again, the safest place to be is home. And we believe that adherence over the next couple of weeks to the directives we have in place will enable us to get from this urgency phase in our state plan to move towards the stabilization effort and then to recovery. So what we do today will help us improve tomorrow. And so I appreciate the fact that we have most everybody on the same page there. And let's just make sure that we continue our efforts in that regard. Regarding the Utah Leads Together plan, which we presented, and again, I can tell you, and having talked with governors throughout this nation, our plan, which has been the work of so many bright people with the input from many different sectors of our business economy, but mostly from our medicine, our scientists, as we provide recommendations to the task force group and developing this plan. If you read the plan, you'll find that the urgency stage we thought would go from 8 to 12 weeks. I have a hope that we can shorten that time frame. In fact, we're continuing to work with our business community and all sectors of the economy to develop a strong plan now to move into the stabilization and recovery efforts. And that's our next two phases, which I feel confident we can move into shortly. In the coming days, as we are doing a lot of detailed work and analysis on the data, to let us know where we are at, talking about peaks and valleys and those things, the unemployment rate and the employment rate, all together to decide when we're going to be able to, in fact, loosen some of the restrictions that we have on the economy. And this plan that we'll have, which we'll call this next phase, stabilization, will be, in fact, based on good data as we develop a more detailed plan of how we go forward out of urgency into stabilization. We do that, and then the next comes then recovery. We have to do them one at a time, and we're in fact doing well on our urgency phase, and I think this stabilization is close around the corner. We'll be giving you more information on that as we work with other important business leaders, our state leaders, our legislature, local government officials from around the state, and make sure that we have a good, solid plan for recovery. So hopefully we'll have more information on that in the next few days, and we'll announce it here, probably the first part of next week, how that looks and how it's shaping up. Just a reminder as I conclude this part, our directive, in fact, requires people, in fact, to eliminate all but essential travel. Again, I know that's hard to do, but there are things you can do, and doesn't mean you can't go outdoors. Again, reminding you again to keep your social distance appropriate, 6 feet is a minimum, and find more isolated areas to recreate outdoors, but things you can do. Staying closer to home will help us with containing the spread of the coronavirus. One of the reasons to be out is in order to buy food. We've talked about with our restaurant organizations and fast food operations, the 3T challenge, we call it. We want you to get takeout 3 times a week to help these establishments stay afloat. But we also want to remind people about our retail food stores. That's where most of us go to get our food. And that continues. They work very hard to keep those supply chains open, and that our shelves are stocked so we can go there at convenient to purchase what we need to have in our home. And so I just want to again say how much we appreciate our retailers in all walks of the economy, particularly our grocers and others who are doing so much to maintain very strict hygiene protocols and standards in their stores. They monitor the social distancing. Even as they limit people coming in their store, we need to make sure we continue to have social distancing in the lines that we create waiting to go into the stores. So again, we appreciate what they're doing, that they're going above and beyond. They're doing what they can to earn the confidence of the consumer that these are safe environments to come and shop. So let me say that we ought to help our retailers. And so I'm asking Utahns to show their support by wearing a personal protective mask or face covering whenever you enter a retail store. This is more of a commercial variety. I know my wife's made a couple of just quite attractive face masks out of cloths that she sewed up together. So people can have them. It's not that hard to get to, a little ingenuity, and you can have a face mask, which will make people feel good around you and certainly help protect the employees at our retail outlets. So again, I'd like to ask everybody to now show your respect and support for our retail stores, particularly our grocery stores, by wearing a mask. With that, let me just mention one other note of information. Just as I came down here a little earlier today, I found out that we've already had closures of Arches, Canyonlands, Zions, and Bryce Canyon National Parks, and we've been informed that from the National Park Service, that Capitol Reef National Park is now closed. So all 5 of our national parks are now closed. I'm sure that, like you, we're hopeful to get through this over the next few weeks and have them open up again and have opportunities to visit not only our national parks, but for all of us to be able to visit our state parks. These are anxious times. Many families are under stress. This is just kind of a new environment we've never been involved before. I see polling that not only we're concerned about the stress on ourselves and our health, but the poll now shows that 60% of us to 40 are more concerned now about the economic health of our state and our well-being of jobs and opportunity for ourselves and our family members and friends to stay employed. And we've had a dramatic increase, of course, in unemployment. We're doing what we can at the state level, and certainly the federal government's providing monies to help us get through this part with some infusion of capital. That being said, the stress that happens to individuals and families is acute. I'm pleased to mention that Intermountain Healthcare has just set up a new emotional support line. If you're feeling anxious, worried, stressed, saddened, this resource can connect you with help providers who can give you good counseling and give you some direction to help you get it through this troubled time. So we're grateful for community partners like Intermountain Healthcare and many others who are already doing so much on the front lines of our healthcare challenges that we face, uniquely so, and are going the extra mile to make resources like this available to all of us. So with that, I've asked Mikelle Moore, Senior Vice President of Community Health of Intermountain Healthcare, to talk to us more about this emotional support line. So Mikelle will invite you to come in and speak to us now.
Thank you, Governor. Mental well-being has been central to Intermountain's mission always, and never more so than at a time like this. This pandemic has many factors: novelty, unpredictability, social isolation that can create and exacerbate stress. And our caregivers are experiencing that in Intermountain, our community's experiencing that, and our public. We've had to find new ways to reach out and engage people at a time when we're physically distanced and may not have access to deliver supportive services in the usual manner. This hotline, the Emotional Health Relief Hotline, is a free resource for healthcare professionals, for community members, anyone in our region seeking emotional health guidance during these uncertain times. Callers who call the hotline are connected with a trained caregiver who can provide appropriate self-care tools, peer supports, connect to treatment options, crisis resources, and more. It's available 7 days a week from 10 a.m. to 10 p.m. The phone number is 833-442-2211. Interpretation is available for 20 different languages. This service is free. For some callers, we may recommend referral to certain treatment options that follow regular billing processes. Some may offer financial assistance or be covered by insurance, which will be explained as the person reaches out and makes those connections. But the call to the hotline is completely free. In situations of acute or imminent psychiatric crisis, the care coordinator will stay on the line while connecting the caller to our colleagues at UNI on the crisis care line. Those representatives will deploy additional help and resources for a crisis. In non-crisis scenarios, coordinators will help connect people to key resources, including employee assistance programs, local mental health authorities, domestic violence services, clinical treatment teams, and peer counselors. And really importantly, they'll connect callers right then to free educational materials and digital self-care technologies that can be a resource. So this was built quickly. Normally it would take something like 4 months to create this type of service, and I'd like to thank our team at Intermountain and a number of community partners for pulling this service together in 4 days. It's been providing services to Intermountain caregivers for about a week. We're dependent on constant input and linkages to state partners, including the Department of Human Services and the University of Utah's Uni Crisis Line. So thank you very much to those collaborations and partnerships. For staying healthy, I'd like to take this opportunity to remind everyone, Governor, that staying mentally healthy during this unusual time is so important for each of us. Our first step is to take care of ourselves. I've found it's helpful to get some exercise every day, even if it means taking a walk while I also manage a phone call or a meeting virtually. Try to find and maintain routine for yourself and for your family. Look for intellectual engagement in places beyond the internet. Second, stay connected to people you care about. We're fortunate to live in a time of technology that can make it easier for us to connect with people all across the country or right around the corner to stay connected to the people we love and trust. Third, try to remember that things will get better eventually, and they will get back to normal. The world is not coming to an end. People are good, and we will help one another through this. Thank you so much, Governor, for your leadership and for the opportunity to serve with you on the task force and bring solutions like this to our community. Thank you.
Well, thank you, Mikelle. We appreciate your leadership and the work of Intermountain Healthcare. So thank you very much for being here today. We may have some questions now. Let me just mention before we take questions that, again, for those who like more information, we do have a web page which is up and running and improving all the time, coronavirus.utah.gov. Coronavirus.utah.gov, G-O-V, is a good place to get constant, ongoing sources of information and details about what's happening in the state of Utah with this COVID-19 pandemic. So with that, is there any questions we might have out there? Okay.
Great. Thank you, Governor. Stay home, stay safe has now been extended toward the end of the month. We're also getting close to that time when school would normally end the school year. Is there any consideration at this point to basically concluding that there will not be any return to the actual campuses for schools in the state?
Thank you. As you know, regarding our public education schools, we have a directive in place that the suspended school, we call it a soft closure, meaning we expect students to still continue to be taught by their teachers. They have homework assignments. I know I've talked to some parents thinking that their children are more busy than ever before, even though they're involved in distance learning. That soft closure continues till May 1st. I will be meeting here in the next day or two with Superintendent Sid Dixon and also the chairman of the state school board, Mark Huntsman, to do an analysis and a review of how we've done, where we're at, and what we should do going forward in light of the shortness of the year time. Do we come back into school for 2 or 3 weeks, or do we, in fact, suspend the school year or continue what we're doing now? So that's yet to be determined, but know that the public schools will be closed at least until May 1st, and we'll probably have an announcement on what we will do or not do sometime next week. Brian? Did we lose Brian?
Yeah, Governor, as you look to you extend your directive until the end of April, how are you going to approach so that, on May 1st, you don't have people gathering in crowds or, basically not social distancing anymore, to ensure that there's that you don't get right back to more outbreak?
Well, that's why we're going to look at the data and let the data tell us what we should be doing. Data really is what drives our policy. We're trying to make sure that this is not driven by just emotion, by fear, by politics. The data should tell us what we should do. And so we are anxiously and vigorously compiling data to help us understand the trends and to see when, the peak and how the infection rate is going and which direction it's going. Are we plateauing and when will that happen? So when we come to the May 1st deadline, we'll have an opportunity to either continue with what we have in place or make some modification of that. That's yet to be determined. I am concerned about making sure that we don't allow a reoccurrence and a surge of the coronavirus in our communities. But I'm also concerned about making sure that we have the ability to return to more normalcy and make sure that the economy continues to function and to recover from the doldrums that it's in right now, as we all understand and appreciate. So it is like threading a needle. It's trying to find that optimal place with policy that works for everybody as best that we can. And as I mentioned before, and I'll just say it again, it's not one versus the other. It's really working together in concert. So I'll know more about what the data shows us as we get into next week and have an opportunity before the end of April here to decide whether to extend or modify the directive that we have in place today.
Herbert, Bloomberg News reported this morning that White House Chief of Staff Mark Meadows has been calling the governors who have not issued a statewide stay-at-home order and urging them to do so. Have you spoken with Mr. Meadows about this? Has he been urging you to issue a statewide order? And can you characterize what those conversations have been like?
Mark Meadows has contacted my office to set up a phone call actually last week. And he was going to call. He did not call. I have no idea why. He's called me before. He has my cell phone number. He could leave a message, for example, if he wanted to call. But for whatever reason, we've talked with some of the staff members in the White House. And of course, then I had the discussion with Dr. Fauci, which I think probably superseded whatever Mark Meadows wanted to talk to me about. As we had the conversation, I think Dr. Fauci, I've been told, mentioned Utah in his press conference yesterday in a favorable light. Again, as he understands what we're doing, he believes it falls very much in line with what other states have been doing. And as we talked about, the concern that we both have is, are we letting semantics get in the way of what really is happening? Whether it's an order or a directive, we have a statewide directive that we expect the people of Utah to follow, and guess what? They are. As we look at the behavior patterns of the people of Utah with other states, they're very much the same. In fact, in many instances, ours are better. So again, I think Dr. Fauci is very pleased with what we're doing and the results that we're getting. So we want to continue in that vein. I think we're doing well. But all things are on the table, and we can pull the levers in the direction we think will help us to achieve the outcomes we're all wanting to have, and that's slow down the spread of the coronavirus and have an opportunity as soon as possible to open up the economic opportunity for the state. One last question.
Yes, good afternoon, Governor. Trip Baltz with Bloomberg Industry Group. I wanted to ask about the travel order, the travel declaration that you issued. Any sense as to how that's going at the checkpoints, and how many resources do you have dedicated to that in terms of state troopers or staff? And do you get a sense that travelers are complying with it?
Our travel declaration and what we're trying to do is really in somewhat of a limited fashion. It's not exhaustive. We are doing it electronically so that people get a text message when they're driving into our state, asking them if, when they come into the state at their next opportunity, if they stop or whatever their final destination is, to fill out a simple questionnaire. It's not hard, it's not long. So we can have a sense for where people are coming from into our state, if they've been exposed to COVID-19, if these people have had COVID-19, or if they have any symptoms. If they have symptoms, we want to help them. We don't want them to engage and expose themselves to friends, family, strangers. Again, I think most people would like to have that assistance, and that's what we're trying to provide. The Salt Lake International Airport, a similar thing is trying to take place, again, as people fly into Utah as their final destination. that they'll have an opportunity to be given a questionnaire and an opportunity to fill out and give to us so that we can, again, have some information about what their whereabouts have been, where they're coming from. Have they had the COVID-19? Do they have symptoms? And if they do, then we want to see what we can do to help them to get past those symptoms, including, if needs be, to have them be isolated, may it be self-isolation or quarantine. But this is somewhat of a work in progress. Our Department of Transportation is overseeing this. We have technology that's going to help us to do this. Is everybody going to comply? Probably not, but we think a majority of people will do it because it's the right thing to do. And we have no plans to, send out the police or arrest people. But we'd like to have voluntary compliance with this and see if we can't help. Again, it's just another tool in the toolbox to help us slow the spread of the coronavirus. So stay tuned on that. We'll see how that works. We'll see how this next week goes. And we'll probably have some information to share in the next week. With that, let me just, before I close, I've got one final thought I wanted to offer to the people of Utah. I do observe that many people across the world consider this a holy week. And for Christians, it's the recognition of the crucifixion and resurrection of Jesus. For our Jewish friends, they're just finishing the Passover today, and part of their tradition and their religious orientation. Tomorrow is, in fact, the Muslim Sabbath day and Good Friday. It's an opportunity for us all to celebrate a faith in something beyond ourselves. And I know that many people are, in fact, getting together in this week, probably driven because of the pandemic we have worldwide, and saying maybe there's an opportunity for us to unite in prayer and supplication and ask the heavens to give us a blessing. Now, that blessing could come in many different forms. It's maybe one of courage, maybe it's one of understanding, maybe it's one of enlightenment, maybe it's one of understanding of what we can do better than we're doing now, certainly as a society. President Trump mentioned it yesterday in his press conference, and inviting the United States people, Americans, to, in fact, join in some kind of prayer effort here this weekend. And so I want to add my voice as the governor of Utah and as a man of faith and say, I too am going to join in this fasting and prayer and supplication in our behalf as a state. My wife and I and our family will join in doing that same thing. And we would like to invite the people of Utah, whatever your religious affiliation is, or if you have no religious affiliation, let's all join together in a united effort to ask for the blessings of heaven to come upon us. I think we all know that we need a little extra help, and that request could be to eliminate suffering of people out there, to help us find ways, in fact, to improve our medical treatments, to find cures, solutions to the challenge, certainly to help us with our economic recovery. And so I think it's important as an opportunity for us, in fact, to pray for wisdom and enlightenment to see if we can't do things better. Let me also add, as we pray, and I believe in the efficacy of prayer, we have a lot of needs out there that we can ask for this weekend. Certainly the pandemic is at the top of the list, and finding a solution to that and help economic recovery to occur. And we would like to have some miracles that take place. Maybe the miracle is going to be in our own selves, our own lives, and how we conduct ourselves. But along with the request, I would hope that all of us understand, in spite of the challenging times that we face, we have a lot to be thankful for. We have many blessings here in Utah. And I would hope that along with our supplication and requests, that we'd add a thank you for the blessings that we've received as a state, and we're continuing to receive as we go forward. So let me conclude by saying, as I invite everybody to join with me and my family and others around the state and around the country and around the world in this united effort, that we add to that not just the prayer aspect of it, but let's see if we can't find somebody to help. Let's not only pray, but let us do something to help our neighbors, those who are less fortunate, those who need a helping hand. we don't have to look very far to find those people who are looking for maybe just a shoulder to lean on and a helping hand and a word of encouragement. So along with our prayer efforts, let's make sure that we have our do efforts in place where we do things and help people. We have an opportunity because we are a blessed people here in the great state of Utah and here in America. My father shared always a piece of wisdom, I think, that stayed with me all my life. And I think it's apropos for this time. And he used to say to me, Gary, let's pray like everything depends on the good Lord. But then let's work like everything depends on us. I want you to know that this state of Utah and the people are working hard. We will continue to work hard. And as we do that, together, we'll find a solution to this challenging time. Thank you very much.
Thank you, Governor Herbert. And we're grateful for our media partners who make this daily briefing possible. We really appreciate being able to share important messages with the people of Utah on a regular basis. Special thanks for technical assistance from Fox 13 and PBS Utah. We're also grateful for the pool photographers from Salt Lake Tribune, the Associated Press, Deseret News that are here in the room each day. Tomorrow, the briefing will commence at 1:30 again. It will be Angela Dunn here. We anticipate having the governor back on Monday. Thank you very much.